Dysphagia. Difficulty in swallowing is known as dysphagia. It may be a sensation that suggests difficulty in the passage of solids or liquids, a lack of pharyngeal sensation, or other inadequacies of the swallowing mechanism. Dysphagia is distinguished from odynophagia, which is defined as painful swallowing, and globus, which is the sensation of a lump in the throat. The most important step in evaluating dysphagia is a careful history. Patients will report a sensation that food or drink sticks, holds up, or stops. The age and comorbidity profile of the patient can also guide the differential diagnosis. The elderly are more likely to have a malignant or oropharyngeal cause. Younger patients are likely to have an inflammatory cause, such as eosinophilic esophagitis. Patients with connective tissue disorders may have underlying esophageal dysmotility or complications arising from chronic reflux. Sudden onset dysphagia is seen with a large bolus of food or foreign body stuck in the throat. Insidious onset is more common with webs and strictures that develop over a period of time, following infection, trauma, or inflammation. Tumors that compress the esophagus also develop over a period of a few months. Acute dysphagia is seen with inflammatory conditions, such as esophagitis, pharyngitis, stomatitis, large bolus, or foreign body stuck in the throat, and sometimes even anaphylaxis. Chronic dysphagia results from long-standing conditions, such as esophageal webs, post-inflammatory strictures, benign tumors such as lipomas, papillomas, and malignancies of the esophagus and oral cavity. Persistent dysphagia is one that is not relieved on change in position and is not specific to certain kinds of foods. Commonly seen with webs and external compressions from surrounding structures. Transient dysphagia is one that is felt sometimes and disappears on its own. Polyneuropathy in intensive care unit patients is a common cause. Intermittent dysphagia is a feature of dysphagia lusoria. Progressive dysphagia is one that worsens over time, commonly seen with growing strictures and tumors. The various mechanisms that have been implicated in dysphagia are as follows. Oropharyngeal dysphagia results from neuromuscular causes, mostly the upper esophageal sphincter is involved. Esophageal and esophagogastric dysphagia results mostly from motility disorders. Two distinctly known abnormalities are diffuse esophageal spasm and achalasia cardia. Obstructive lesions of the esophagus produce progressive dysphagia. Mostly seen in esophageal neoplasms, also in benign and malignant strictures of the esophagus and neoplasms of the gastric cardia. Inflammatory lesions, such as reflux esophagitis, also cause dysphagia. Paraesophageal lesions can mimic the obstructive symptoms. Causes include thyromecally, mediastinal neoplasia, left atrial enlargement, anomalous aorta, and prior surgery or radiation. Difficulty in swallowing solids is seen in physical causes of narrow esophageal lumen, such as webs, strictures, and tumors. Difficulty in swallowing liquids, but not solids, is seen in damage of nerves, responsible for the swallowing reflex, or conditions such as achalasia cardia, causing spasm of the esophagus. Painful dysphagia is seen in infections, inflammation, heartburn, candida infections of the mouth, esophageal cancer, injuries, or ulcers in the mouth and throat. Mild dysphagia is the feeling of food just taking longer to pass through the esophagus, and it can be painless. Factors aggravating dysphagia include food, smoking, alcohol, lying down, sore throat, and trauma. Factors relieving dysphagia include repeated swallowing, small sips, thick fluids, raising arms over the head, sitting upright after meals, rest, and sleeping with head elevated. Factors associated with dysphagia include loss of weight and malignancies, loss of appetite, heartburn and GERD. Cough, hoarseness of voice and external compressions, and tracheal growths, mouth ulcers and candida infections, chest pain, gurgling sounds, neck bulge, aspiration, fever, and muscle pain. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.